Welcome, the Heart Failure Academy, a series of educational talks to increase your understanding of the disease and how to care for yourself. Presented by Carla Gunderson and Samantha Hassan. We'll start with part 1. The objectives of this talk are to increase your overall understanding of the disease process of heart failure, list 5 heart failure self-care habits that promote wellness, and recognize at least 2 symptoms that would signal calling your physician or heart failure nurse. Heart failure, what's the big deal? Well, 1 in 5 Americans will develop heart failure in their lifetime. More than 6 million today are living with heart failure. By 2030, it is estimated 8 million plus will be living with heart failure. We hope this presentation will help you understand and manage your heart failure. So, the scary news, you've been diagnosed with heart failure. The good news, we know heart failure is manageable and does not mean that your heart has completely failed. The scary news, heart failure is increasing in prevalence. 1 in 5 people will be diagnosed in their lifetime. Most common reason for hospital admissions in people over age 65. The good news, we have medical advances that have developed new and improved treatments, and we have new things coming along to help manage you and to have a team of healthcare specialists to help you. The scary news is it is chronic and lasts a long time. It is progressive and may get worse over time. The good news, you're not alone. You have the ability to do something to change your outcome. Here we're going to talk about the natural progression of heart failure. Heart failure is a chronic disease. It does not go away. Upon initial diagnosis, your ability to do everyday activities is typically low and your symptoms are very troublesome. After diagnosis and starting treatment, our goal is to minimize symptoms and improve your quality of life. This is largely dependent on lifestyle changes and following the plan of care you decide on with your doctor. What we of course cannot do is halt the aging process. Despite best treatments and self-care, your heart failure will worsen over time, as well as your risk for developing other conditions and illnesses that can worsen your heart failure at any time. This slide is going to show you what the normal heart looks like. It's a muscle about the size of your fist. It consists of 4 compartments called chambers. The right side consists of the right atrium and the right ventricle. This side receives oxygen-poor blood from the body and then pumps the blood into the lungs. The left side of your heart consists of the left atrium and the left ventricle. This side receives oxygen-rich blood from the lungs and pumps the oxygen-rich blood to your body. Now we'll talk about the heart failure heart. The heart failure process is usually gradual, and it is just a dysfunction of the pump, meaning that it's not pumping the blood forward and the fluid can back up, causing many heart failure symptoms. The heart muscle may become thick or the ventricles may dilate. Sometimes both occur. There are varying degrees of severity based on your symptoms and your physician's observation. So let's talk about symptoms. This is a list of heart failure symptoms. It's only some of the symptoms. You may have some that are not on this list. Because of the heart not pumping well, we have backup of fluid causing shortness of breath, a cough, weight gain, tiredness, fatigue, confusion, you can't think clearly, edema, which is swelling, usually in the legs, feet, or abdomen, loss of appetite, abdominal discomfort, Again, these symptoms are related to excess fluid or lack of oxygen to your body tissues due to your heart's inability to pump adequately. Each person's symptoms are different. You may experience symptoms that are not on this list. Heart failure classification or stages. When you see your heart failure provider, they will ask you about your symptoms. And using this information they gather, they will classify your heart failure. This is used to help manage your heart failure treatment. Classifications are 1, 2, 3, and 4. Number 1, you have no limitations or symptoms. Number 2, slight limitations with ordinary activity. Number 3 are marked limitations. You're okay at rest, but any ordinary activity causes you to have symptoms. And number 4, you are unable to do any activity without symptoms, and you have symptoms at rest. Another guideline for managing is the stages of heart failure. You can see we have stages A, B, C, and D. In stage A, we call this pre-heart failure. You have not been diagnosed, but you are at risk for developing heart failure, maybe because you have high blood pressure or diabetes. B, you've been diagnosed but currently have had no symptoms. C, you are having current symptoms or you've had symptoms in the past. And stage D is advanced symptoms, unrelieved by any treatment. So this is how heart failure is diagnosed. Usually you'll present to your provider with symptoms, or you may not have any symptoms and it's found on a routine exam, such as a yearly chest x-ray or a yearly EKG. But most times in general, it's symptoms, and it's diagnosed by your medical provider. They may see something on your chest x-ray. Your blood work may show some signs of heart failure. The gold standard for diagnosing heart failure is the echocardiogram or the ultrasound of the heart. Another way is through heart catheterization. At diagnosis, you will talk with your doctor about the type of heart failure you have. This slide shows the types of heart failure. The first one, systolic. This is a problem with a weak squeeze. Your heart is often enlarged or dilated chambers. Your ejection fraction, or EF, is reduced. Diastolic heart failure is a problem with the relaxation of the muscle. You may have been told you have a stiff heart. The walls are thickened, and you may have a preserved ejection fraction, or what we call a normal EF. Right-sided heart failure occurs when the right ventricle has difficulty pumping the blood into your lungs for one reason or another. In all types of heart failure, the amount of blood pumped out of the heart may be decreased. The most common cause of right-sided heart failure is left-sided heart failure. This slide shows an enlargement of the 3 hearts we showed on the previous slide. You can see in the diastolic dysfunction on the right side that the walls of the heart are thickened. And when the walls of the heart are thickened like this, the chamber inside of the heart is smaller, so it holds less blood. In the systolic dysfunction on the left side of the heart, you can see that that muscle has gotten weak. It has gotten big and baggy and weak, and it does not pump adequately. Again, we want to talk about that ejection fraction, or EF. This is something you're going to want to talk to your doctor about when you're diagnosed. What's my ejection fraction? Well, it is the amount of blood pumped out of the heart compared with the amount of blood left in the heart with each beat. So if your heart held 100 milliliters of blood and 50 millimeters is pumped out with each beat, the doctor would tell you your ejection fraction is 50%. And that would be normal. Normal ejection fraction is 50 to 65. Borderline reduced is 45 to 49. Reduced is less than 45%. but it is possible again to have heart failure and have a normal ejection fraction. This is diastolic heart failure, where your heart may only hold 60 milliliters of blood, and each time it pumps out 30 milliliters, which is an ejection fraction again of 50%, but the total amount pumped out to your body with each beat is less than it should be. We're moving on to causes of heart failure. There are many causes of heart failure, and it can affect people of all ages for many reasons. Some causes are avoidable, some are not. It is very important to address the cause of your heart failure along with lifestyle changes when you meet with your doctor. When your provider is diagnosing, they are going to be looking intently for the cause of your heart failure. Again, this list is only some of the causes. If you don't know what the cause of your heart failure is, please ask your provider. So let's recap heart failure. Who's in charge of your health? Well, you are. You are the one in charge of your body. You are the one who's going to make the changes. What is heart failure? It's a weakness of the heart as a pump. It's the inability of your heart to pump the blood forward adequately. Do you know what your ejection fraction, or EF, is? If not, how can you find out? Please ask your healthcare provider at your next visit. Is there a cure for heart failure? No, there is no cure, but it can be treated and managed with lifestyle changes and guideline-directed medical therapy. This ends part 1 of the Heart Failure Academy.